So political bias impacting the therapy. Can you give us examples of that?
It really runs a spectrum. I kind of like to think about it as having like basically four levels of bias. One would be activist therapists, which do exist where they might e- explicitly think that they should bring their political ideology into sessions and maybe proselytize to their patients, or even reject patients from therapy if they don't have the right views. Um, I'd say the next level of bias would be therapists who they're not doing that, but they have very strong political views. They're uncomfortable talking about certain topics. They might be very judgmental. They might be hostile to certain views. They might have rigid stereotypes. Um, it, that would be like a very biased therapist. The next level of bias would be somebody who really means well, wants to be a really good therapist, but is maybe they don't know how to treat patients with different views. So like they don't understand things about different experiences and perspectives that patients might have. And what we want is to get to a place where therapists are skilled and knowledgeable, working with a wide variety of patients.
So let me ask this a little more tightly, because what you just described seemed to be a description of the range of human types. There are people out in the street. If I walked out here on Sixth Ave, I might find people who fall into all those characterizations. But we're talking about people in a professionalized context. They're putting on their persona as therapists, and yet they're still falling into the categories you just described. There are people
Right.
who, as therapists, when they walk in that room and
Yeah.
switch into those professional norms.
Yeah.
So, what I'm asking about is, what are the professional norms of therapy?
Yeah. Yeah.
Are these people flouting the professional norms, or are these the professional
Yeah.
norms?
So, for over half a century, the standard in mental health has been treatment should be patient centered, should be focused on the patient's goals and values, and the therapist or the other provider should be attuned to the patient's values. Where things have gotten derailed, I think, in the past 10 years or so, it really comes, I think, for the people who are activist therapists, the way that they would probably frame it is um, they're confronting racism. So obviously, if you have a racist patient, you'd need to address that. That's totally reasonable. There's nothing biased about confronting racism. There's nothing biased about confronting sexism or homophobia. So those are reasonable things for therapists to do. But their definition of what racism is and what sexism is more and more expansive. So disagreeing with affirmative action policy, well, that's racism. Got to confront that in session. Voting for Donald Trump, that's racism. Your views on immigration, that's racism or sexism. So the views get very expansive. And then now all of a sudden, the therapist is kind of using their role as a therapist to kind of weigh in on a wide range of ideological issues.
But let me be sure I understand. So, how is patient-centered therapy compatible with responding to people's racism and sexism?
I don't think that they're compatible. I think the field has drifted away.
But
Um,
I'm sorry, I didn't mean to interrupt, but I thought you said that it's okay and reasonable for people to address people's sexism or racism, but the problem is that people are defining those terms so broadly now.
um,
But I'm asking about the core
no,
case.
yeah, no. I think for the people who practice what I would call like an activist oriented or social justice oriented psychotherapy, that's what their rationalization looks like.
I see.
So they would rationalize it as we are still basically being patient centered. We're not really being biased. We're just addressing racism. I think that's how they would describe it. Um, the problem is exactly what you're saying, which is that it's very easy once you bring that into therapy sessions. It's very easy to stop being patient centered and for it to be a slippery slope to disagreeing about every political issue that exists.
But so, is there a space in therapy for moral judgment of your patient's views?
Um,
Moral judgment. So, a person has a view about women, for example, and
yeah,
and the role in society.
yeah.
Um, Is there space there for that and a healthy therapeutic relationship in your view?
There could be. I mean, imagine like a very narcissistic patient who is being very aggressive towards women and or or it could be a narcissistic woman who's very aggressive towards men. But there might be a way to say, um, you know, that worldview and that stance is creating problems for this patient, and that being candid about that is reasonable.
So goals of their own, for example, to have a long-term relationship or to have healthy relationships with their children, goals of their own might be thwarted by things and thought ideations and patterns that they have. Patterns
Yeah,
that they have.
or even just like feeling grounded or emotion dysregulation stuff, or why aren't people getting along with me, or what? Like it would probably if they're acting in like a pervasively aggressive way towards people, it probably is impacting their life negatively.
So thanks for that background for me.
Yeah,
That's helpful.
sure.
It's helpful to me. So let's move now to the Open Therapy Institute and what you're seeing out there. Um, what kinds of can you give us some examples of therapeutic interventions or experiences that have come to your attention that motivate your work?
Yeah, I mean, increasingly, I mean, especially in professional bodies and in a lot of training programs, therapy students are taught that every therapy needs to broach race and issues like white privilege. Um, every therapy needs to conceptualize the patient and therapist as privileged or oppressed based on certain demographic categories. Um, Often they're taught to think about race in terms of or gender in terms of these very preordained scripts where the Black patient is their chief problem in life is racism from white people, and they have a whole set of beliefs and values that are shaped from that, and the therapist needs to view them in a particular way. So I'd say these ideologies are really intensely coming into training, and a lot of those ideologies are explicitly advocated by professional bodies in the field.
Can you give specific examples? Are there particular cases that stick out in your mind?
Of like therapists actually doing this?
Yeah, of therapeutic experiences of patients where they're getting this kind of care.
Yeah, we're emailed weekly by patients, several times a week by patients looking for a therapist to report things like this, and it really does.
Give an example.
So I wrote an op-ed about that had one example where I was at a clinic where a patient said that he disagreed with affirmative action, and I guess the situation was he didn't get a fellowship
This is a Jewish
because
patient, as I remember.
yes, it was a Jewish patient, and didn't get a fellowship, which he felt was because of affirmative action policies. And the response to so we discussed this case in a case conference that was probably 2 or 3 dozen people with social workers, psychiatrists, everybody in the field, and there was an apparent consensus that the patient was racist for having this view, and that because of that, the patient needed to be referred out and seen elsewhere. That the therapist, who was a woman of color, couldn't be expected to see such a racist patient. They're not.
I'm sorry, let me
Yeah,
catch that.
sure.
So that the therapist professionally should not be expected to deal with a patient with those kinds of.
Yeah, and it exactly shows the slippery slope of the racism thing that I was talking about earlier, where it's like, yeah, if you were a Black therapist and you're treating a patient who's an actual white supremacist who is bombarding you with hostility for your race the entire time, you actually wouldn't be expected to do that. On the other hand, having a fairly run-of-the-mill opinion about affirmative action, that probably a majoritarian opinion, is a totally different thing. And there's this conflating of the two that can lead them to really, really mistreat patients.